September 14, 1944, Field Hospital, Metz, France, 1847 hours. The morphine syringe made a soft clicking sound as Captain Daniel Morrison pressed it into the arm of the German doctor lying on the canvas stretcher, a sound so quiet it was nearly lost beneath the groans of wounded men and the distant rumble of artillery. Dr. Klaus Brenner, 42 years old, a surgeon who had served in Wehrmacht field hospitals from Stalingrad to Normandy, lay with his left leg shattered by shrapnel from an American artillery strike that had obliterated his aid station 3 hours earlier. His eyes, gray alert despite the pain, tracked Morrison's movements with the wariness of a man who had been taught to expect brutality from enemies, who had spent months hearing propaganda about American savagery, who had seen Soviet treatment of captured German medical personnel and assumed all enemies would behave similarly. But Morrison's hands were gentle as they checked the tourniquet, professional as they examined the wound, careful as they adjusted the blanket against the September chill. And when Morrison noticed Brenner's medical insignia, when he recognized a fellow physician rather than simply another enemy combatant, his expression shifted into something Brenner had not expected. Collegial respect? The acknowledgement of shared professional identity that transcended national enmity. Morrison called over a German-speaking orderly and asked, through translation, whether Brenner needed anything besides the morphine, whether he had other injuries, whether there were medical supplies or instruments he wanted retrieved from the wreckage of his aid station. The questions themselves were disorienting. Here was an American captain, a physician, treating a captured enemy doctor not as a prisoner to be processed or an intelligence source to be exploited, but as a colleague who had been injured while performing the same work Morrison himself did, saving lives under impossible conditions. Brenner's response caught in his throat, not from pain but from the cognitive dissonance of being treated with dignity at the moment when he had expected, at best cold efficiency and at worst the revenge he had been told to anticipate for Germany's conduct of the war. The sound that defined this moment was not the morphine click or the artillery rumble, but something quieter and more profound, the scratch of Morrison's pen on paper as he completed a medical chart for Brenner, documenting his injuries, treatment, and prognosis with the same thoroughness he would have applied to an American casualty. Each notation was an assertion of medical ethics that superseded warfare. Each recorded detail was evidence that American military medicine operated according to principles that treated wounded enemies as patients deserving professional care rather than as defeated adversaries deserving only minimal attention. The pen scratch was the sound of documentation, of institutional commitment to standards, of a medical culture that maintained professional identity even in contexts where abandoning such standards would have been tactically convenient and personally satisfying, given what German forces had done across Europe. This moment, an American military physician treating a captured German doctor with professional respect and providing care that exceeded the minimum required by Geneva Convention obligations, exemplified a profound asymmetry between how democratic and authoritarian military medical systems approached their fundamental mission. For German medical personnel who had served under a regime that had systematically corrupted medicine into an instrument of racial ideology and military expediency, who had witnessed the Wehrmacht's brutal treatment of enemy wounded and medical staff, the experience of American medical care became an involuntary education in what professional medicine could be when divorced from totalitarian ideology and supported by institutional commitment to ethical practice. What they encountered challenged not just their expectations about enemy conduct, but their entire framework for understanding the relationship between medical profession and military authority, between professional ethics and national loyalty, between healing mission and political ideology. To understand the magnitude of this transformation, one must first comprehend the state of German military medicine by September 1944, and the ideological corruption that had systematically undermined medical ethics throughout Nazi Germany. German medicine had entered the 20th century as one of the world's most advanced medical systems, producing groundbreaking research and establishing training standards that other nations emulated. But National Socialism had systematically poisoned this legacy, introducing racial pseudoscience into medical education, conscripting physicians into forced sterilization and euthanasia programs, and ultimately making doctors complicit in genocide through their participation in concentration camp medicine and human experimentation. even Wehrmacht medical personnel, who had not directly participated in these atrocities, operated within institutional structures that had normalized the subordination of medical ethics to political and racial imperatives. Dr. Brenner represented the complicated position of many German military physicians, professionally competent, personally ethical within the constraint circumstances allowed, but ultimately serving a fundamentally criminal regime whose values had infected even the healing professions. He had trained at Heidelberg University before the war, had completed surgical residency at a time when Nazi ideology was being integrated into medical curricula, and had been conscripted into military medical service in 1941. His 3 years on the Eastern Front had exposed him to the brutal reality of Wehrmacht medical practice under conditions of systematic collapse, inadequate supplies, overwhelming casualties, and the racial ideology that determined which wounded received treatment and which were left to die. He had performed amputations without anesthesia, had watched soldiers die from infections that antibiotics could have prevented, had made triage decisions not based on medical judgment, but on political calculations about which soldiers were worth saving. The professional helplessness had corroded something fundamental in his identity as a physician, had forced compromises with medical ethics that he rationalized as necessary under wartime constraints, but that haunted him in moments of reflection. Wehrmacht propaganda had carefully prepared medical personnel for capture with predictions designed to discourage surrender and maximize resistance. American soldiers, according to these narratives, were barbaric occupiers who would torture prisoners for information, execute medical personnel as war criminals, and show particular brutality toward doctors whom they would blame for German medical atrocities. The propaganda drew selectively on genuine Allied anger about German conduct, the discovery of concentration camps, the documentation of Wehrmacht war crimes, the evidence of medical participation in atrocities, and projected this justified rage onto predictions of how individual prisoners would be treated. German medical personnel were told they would be specifically targeted for revenge, that American medical personnel would refuse to treat German wounded, and that capture meant facing summary judgment for crimes that all German doctors would be held collectively responsible for, regardless of individual conduct. The reality that Brenner encountered contradicted these warnings with such systematic consistency that it seemed almost calculated to demonstrate American institutional commitment to different values. The American medics who had evacuated him from the wreckage of his aid station had treated him exactly as they treated American wounded. Rapid triage, immediate stabilization of life-threatening injuries, morphine for pain, and evacuation to appropriate medical facilities based on injury severity rather than nationality. The field hospital where he now lay operated according to protocols that made no distinction between American and German patients except for security considerations. All received medical care according to clinical need. All were treated by qualified medical personnel, and all had their treatment documented in records that testified to institutional accountability. Captain Morrison returned to check on Brenner 30 minutes after administering the morphine, bringing with him a German-speaking medical officer who could conduct a more detailed medical history. Through translation, Morrison explained the treatment plan. Brenner's leg would require surgery to remove shrapnel and repair vascular damage. He would receive antibiotics to prevent infection, and he would be transferred to a rear area hospital for definitive care and rehabilitation. Morrison asked about Brenner's medical background, learned of his surgical training, and immediately shifted the conversation to professional consultation, asking Brenner's opinion about surgical approaches and complications he had seen treating similar injuries. This collegial engagement, an American surgeon treating a captured German surgeon as a professional colleague whose expertise was valued despite enemy status, violated everything Brenner had been taught to expect about how Americans would treat German medical personnel. The professional respect extended beyond individual interactions into systemic patterns that reflected American institutional commitment to medical ethics. The field hospital operated under protocols derived from Geneva Convention requirements but exceeded those minimums in ways that suggested American military medical culture valued professional standards for their own sake, rather than merely as legal obligations. Wounded prisoners received the same medications as American casualties, including scarce antibiotics that were in limited supply, even for American forces. Surgical cases were prioritized based on medical urgency rather than nationality. Medical records were maintained with thoroughness that testified to institutional commitment to documentation and accountability. The entire system operated with professional systematization that Brenner recognized as characteristic of functional medical institutions, rather than the expedient improvisation that had characterized Wehrmacht medicine by 1944. The morphine syringe that Morrison had used to treat Brenner's pain became a recurring symbol of American medical abundance and commitment to humane care. Wehrmacht medical services had been desperately short of morphine by 1944, forcing German physicians to perform procedures without adequate anesthesia, or to reserve the limited morphine supplies for only the most severe cases. The casual availability of morphine in American medical facilities, where it could be administered routinely for pain relief rather than reserved for extreme cases, communicated messages about relative industrial capacity and institutional priorities. Each syringe represented the pharmaceutical production capacity to manufacture morphine in quantities sufficient that treating enemy wounded with adequate analgesia was routine rather than exceptional. The logistics networks that could distribute medical supplies to frontline facilities with systematic reliability, and the institutional culture that prioritized humane treatment, even of enemies. American medical personnel's conduct toward Brenner and other captured German medical staff reflected a complex mixture of professional identity, institutional culture, and personal values. Many American military physicians were conscript civilians temporarily in uniform, doctors who had practiced in civilian hospitals before military service, and who approached military medicine as an extension of civilian medical practice, rather than as a fundamentally different enterprise. They had been trained in medical schools that emphasized professional ethics, had internalized standards about patient care that transcended political circumstances, and brought to military service expectations about how physicians should conduct themselves that remained largely intact despite military context. When these physicians encountered German doctors, they saw professional colleagues who had been forced to serve an evil regime, but who retained fundamental identity as healers, and they treated them accordingly with the professional courtesy and respect that medical culture traditionally extended across national boundaries. This professional identity was reinforced by American military medical doctrine that explicitly incorporated medical ethics into institutional standards. American military medical training emphasized Geneva Convention requirements, but framed these requirements within broader professional obligations that extended beyond minimal legal compliance. Medical personnel were taught that maintaining professional standards served both humanitarian and practical objectives, that treating prisoners humanely was morally right, but also facilitated intelligence gathering, reduced resistance to capture, and demonstrated American values in ways that supported broader war aims. The institutional messaging was clear. American military medicine would operate according to professional standards even when expedients might suggest shortcuts, and medical personnel who violated these standards would face accountability rather than institutional cover. Brenner spent 5 days at the field hospital before being transferred to a rear area facility, and during those days he observed American military medicine operating at scales and with systematization that contrasted starkly with Wehrmacht medical practice. The hospital treated hundreds of casualties daily, American, German, and civilian, with triage protocols that allocated resources based on clinical judgment rather than political or racial hierarchies. Surgical teams operated around the clock, performing procedures with techniques and equipment that represented the cutting edge of military medicine. The pharmacy dispensed medications with casual abundance that seemed almost reckless to someone accustomed to desperate scarcity. Medical records clerks maintained documentation with bureaucratic thoroughness that Brenner recognized as characteristically American. The institutional impulse to document everything, to maintain records that testified to individual cases and institutional conduct, to create paper trails that provided accountability and enabled systematic analysis of medical outcomes. The ward where Brenner recovered housed both American and German wounded, separated by nationality for security, but receiving identical medical care. American medical personnel rotated through providing care to both groups, and Brenner observed their interactions with interest. The care provided to German prisoners was professional and thorough. If sometimes emotionally distant, American medics clearly struggled with providing solicitous care to enemies whose forces had killed American soldiers, but they provided the care nonetheless because professional obligations demanded it. Some American medical personnel were warm and sympathetic toward German patients. Others were coldly professional, but none provided substandard care, and most maintained basic human decency in their interactions. The range of individual responses existed within institutional framework that ensured minimal standards were consistently maintained regardless of personal feelings. Brenner's surgical procedure occurred on his third day at the field hospital, performed by Captain Morrison with assistance from other American surgeons and operating room staff. The surgery proceeded with professional competence that Brenner, even under anesthesia, could dimly appreciate: proper sterile technique, adequate anesthesia, careful tissue handling, and systematic attention to detail that characterized quality surgical practice. The postoperative care included antibiotics, pain management, and physical therapy consultation, all standard American practice but luxuries compared to Wehrmacht medical care in 1944. Brenner's recovery proceeded smoothly. The shrapnel wounds healed without infection, and within 2 weeks he was walking with crutches and beginning to regain function in his injured leg. During his convalescence, Brenner had conversations with other captured German medical personnel, physicians, nurses, and medical orderlies who had similar experiences of receiving professional care from American counterparts. The consistency of their experiences was striking. All reported being treated according to professional medical standards, all had received care that exceeded their expectations, and all struggled to reconcile this treatment with the propaganda they had been fed about American barbarity. These conversations revealed patterns that challenged Brenner's understanding of his enemy and ultimately of the war itself. If Americans treated captured enemy medical personnel with professional respect and provided medical care that exceeded Geneva Convention minimums, what did that reveal about American society and values? If American military medicine maintained ethical standards even toward enemies, what did that contrast reveal about Wehrmacht medicine and the Nazi regime it served? The transfer to a rear area hospital in late September brought Brenner into extended contact with American military medical culture and provided opportunities to observe how the system functioned beyond frontline emergency care. The hospital occupied converted civilian facilities in Nancy, France, and operated with systematic organization that impressed Brenner despite himself. The facility had multiple wards specialized by injury type, had surgical capacity for complex procedures, and maintained medical records that tracked every patient through the entire care continuum. The hospital's capacity exceeded anything Brenner had seen in Wehrmacht facilities. Hundreds of beds, adequate staffing, reliable supply chains for medications and equipment, and institutional support that enabled focus on medical care rather than constant improvisation around shortages. American medical officers at the hospital treated Brenner with professional courtesy that included him in medical discussions, consulted him about cases similar to those he had treated, and acknowledged his expertise despite his prisoner status. One American surgeon, learning that Brenner had extensive experience treating frostbite cases from the Eastern Front, asked him to present an informal lecture to American medical staff about prevention and treatment protocols. The invitation itself was remarkable, an enemy physician being asked to educate American medical personnel. But even more remarkable was the professional discussion that followed, with American doctors asking detailed clinical questions and incorporating Brenner's experience into their own practice. The exchange epitomized how American medical culture could separate professional identity from national enmity, could recognize expertise regardless of its source, and could prioritize medical effectiveness over political or ideological considerations. The morphine syrettes appeared repeatedly in Brenner's experience, becoming a symbol that connected his initial treatment with ongoing pain management through his recovery. American medical protocols provided morphine routinely for post-operative pain, with dosing determined by clinical judgment rather than scarcity-driven rationing. Brenner received morphine when he needed it, administered by nurses who documented each dose in his medical record, part of systematic pain management that treated suffering as deserving of medical intervention, rather than as an inevitable consequence of war that patients were expected to endure stoically. Each syrette represented the pharmaceutical abundance that American industry produced, the logistics that distributed medications reliably, and the institutional culture that prioritized patient comfort, even for enemy prisoners. The casual availability of morphine communicated, more clearly than any propaganda, the material advantages that American medical services possessed and the institutional priorities that emphasized humane care. As months passed and Brenner remained in American medical custody while his leg healed, he witnessed the systematic operations of American military medicine at scales that Wehrmacht medicine had never achieved even at its peak. The hospital processed thousands of patients monthly, maintained detailed records on all cases, and achieved outcomes that Brenner recognized as excellent by any professional standard. Infection rates were low due to antibiotics and sterile technique. Surgical complications were managed systematically, and rehabilitation programs helped wounded soldiers recover maximum function. The entire system operated with efficiency that reflected adequate resources, proper training, and institutional commitment to professional standards. German medical personnel in American custody also witnessed broader American institutional culture through interactions with guards, administrators, and support personnel. The Americans who staffed hospitals and prisoner facilities were conscript citizens temporarily in uniform, representing cross-sections of American society rather than professional military castes. They brought civilian values to their military service, maintained expectations about due process and fairness, and generally treated prisoners with basic decency unless given specific reasons to do otherwise. This civilian character of American military service contrasted with Wehrmacht culture that emphasized warrior ethos and unquestioning obedience, suggesting different relationships between military and society and democratic versus authoritarian systems. The war's end in May 1945 brought new complexities for German medical personnel in American custody. News of concentration camp liberations reached prisoner hospitals, and American authorities required German prisoners to view documentary evidence of Nazi crimes. For Brenner and other German physicians, the footage from Bergen-Belsen, Dachau, and other camps was professionally and personally devastating. They recognized medical facilities in the photographs, understood the systematic nature of medical complicity in genocide, and had to confront that their profession had been corrupted into an instrument of mass murder. The revelation that German doctors had participated in selecting prisoners for extermination, had conducted lethal medical experiments, and had perverted medicine into killing was shattering for physicians who had tried to maintain professional ethics even while serving a criminal regime. Captain Morrison, learning of Brenner's reaction to the concentration camp evidence, had a conversation with him through an interpreter that addressed the professional and moral questions Brenner was struggling with. Morrison acknowledged that German medicine had been systematically corrupted, but distinguished between doctors who had participated directly in atrocities and those who had served in conventional military medicine. He emphasized that medicine as a profession could be redeemed through return to ethical foundations, that individual German doctors bore responsibility for their actions, but could contribute to building reformed medical institutions, and that professional identity as healers remained valid even after national defeat. The conversation provided no absolution. Morrison was clear about the magnitude of German medical crimes, but it offered a framework for German physicians to understand their profession's future beyond the catastrophe of Nazism. Brenner's repatriation to occupied Germany came in early 1946, part of systematic processing that returned German prisoners to civilian status after security vetting. He returned to a devastated nation where medical infrastructure had collapsed under bombing, and where the profession he had trained for required complete reconstruction on ethical foundations. But he carried with him more than surgical skills and medical knowledge. He carried the memory of American medical care, of professional respect he had received from enemies who had treated him as a colleague rather than merely a prisoner, of morphine syrettes that represented abundance and humanity, of institutional commitment to medical ethics even during war, and of documentation systems that created accountability and testified to systematic adherence to professional standards. The post-war years brought Brenner into Germany's medical reconstruction, into the difficult work of rebuilding medical education and practice on foundations that explicitly rejected Nazi corruption of medicine. His experience of American medical care provided models for what reformed German medicine might aspire to: systematic documentation and accountability, adherence to professional ethics even under pressure, institutional support for maintaining standards, and recognition that medical identity transcended political loyalties. The morphine syrette that Captain Morrison had administered on that September afternoon became in Brenner's memory a symbol of these principles: evidence that medicine could maintain humanity even in warfare, that professional obligations could persist across lines of enmity, and that institutional culture could support ethical practice when properly structured and resourced. The scratch of Morrison's pen completing medical documentation, that sound which had seemed merely bureaucratic at the time, came to represent something profound about how democratic institutions approached medicine and warfare. The documentation was not just record-keeping, but evidence of institutional commitment to accountability, proof that American military medicine operated according to standards that could be reviewed and evaluated, testimony that individual cases mattered enough to be tracked systematically. In rebuilding German medical institutions, similar sounds would echo through hospitals and clinics: documentation being completed, records being maintained, accountability being established. As reformed, German medicine incorporated lessons learned from observing American medical practice during captivity. As decades passed and the post-war generation rebuilt Germany as a democratic society, the experiences of German medical personnel in American custody contributed to broader understanding of what had gone wrong under Nazism and what needed to change in reconstructed German institutions. The contrast between Wehrmacht medicine corrupted by ideology and American military medicine maintaining professional ethics provided object lessons in how institutions should function, how professional standards could be preserved even under difficult circumstances, and how democratic societies organized medicine differently than authoritarian alternatives. German doctors who had experienced American medical care during captivity became advocates for reforms that protected medical autonomy, established ethical oversight, and prevented future subordination of healing professions to political ideologies. Brenner's post-war medical practice included work with international medical organizations, participation in medical ethics education, and testimony about his wartime experiences. He spoke at medical schools about how Nazi ideology had corrupted German medicine, about the necessity of institutional protections for professional ethics, and about what he had learned from American medical care during his captivity. He described the morphine syrette that Captain Morrison had administered as a moment of transformation, not because of the medication itself, but because of what the gesture represented about American institutional values and commitment to professional medical practice even toward enemies. Each telling reinforced the lesson that medicine required institutional support to maintain ethical standards, that professional identity could and should transcend political circumstances, and that societies were judged by how they treated even their enemies when those enemies were wounded and vulnerable. The sound of Morrison's pen scratching medical documentation, the click of morphine syrettes being administered, the routine operations of American military medical facilities, these acoustic memories persisted in Brenner's consciousness as reminders of transformative experiences that challenged and ultimately changed his understanding of medicine, warfare, and the relationship between professional ethics and institutional culture. The sounds represented more than just efficient medical practice. They represented systematic commitment to values that prioritized healing over ideology, that maintained professional standards despite military context, and that treated wounded enemies with dignity, because professional medical ethics demanded it regardless of nationality or military status. In the end, the shock that German POW doctors experienced when encountering American medical care revealed fundamental differences between how democratic and authoritarian societies organized medicine and understood the relationship between healing, professions, and political authority. American military medicine maintained professional ethics not because individual medical personnel were more virtuous than German counterparts, but because American institutions supported and reinforced those ethics, because democratic culture valued accountability and professional autonomy, and because material abundance eliminated many of the scarcity-driven compromises that had characterized Wehrmacht medicine. The morphine syrettes, the medical documentation, the professional courtesy, the systematic care all testified to institutional competence, and cultural values that German medical personnel recognized as superior to what they had experienced serving Nazi Germany. The scratch of pen on medical charts continued in post-war hospitals across both nations, but in reformed German medical institutions that sound carried new meaning. It represented commitment to documentation and accountability, evidence of reformed institutional culture, and the persistent echo of lessons learned through defeat and reconstruction. German doctors who had experienced American medical care during captivity contributed to building medical institutions that incorporated those lessons, that protected professional autonomy through structural safeguards, and that maintained ethical standards through systematic oversight. The transformation was incomplete and imperfect, but it represented genuine effort to build medicine on foundations that prevented future corruption by political ideology. Captain Morrison's gesture in administering morphine to a wounded enemy doctor, his professional courtesy in treating Brenner as a colleague, his systematic documentation of medical care, these seemingly routine actions carried strategic significance beyond their immediate medical necessity. They demonstrated American values in ways that propaganda could never achieve, provided evidence of democratic institutional culture that authoritarian propaganda could not explain away, and planted seeds of transformation in captured enemies who would return to rebuild their nation on different principles. The shock that German medical personnel experienced when encountering American medical professionalism was not just surprise at humane treatment, but recognition that they had served a regime whose values had corrupted even the healing professions, and that alternative systems existed where medicine could maintain ethical integrity. Even during total war, the morphine click, the pen scratch, the systematic operations of American military medicine, these sounds echoed through memory and history as reminders that how societies treat wounded enemies reveals fundamental truths about institutional values and cultural priorities, that professional ethics can persist even in warfare when institutions support them, and that medical care provided to those who have no power to demand. It testifies to the character of the society providing that care. German doctors who experienced this care carried its lessons forward into post-war reconstruction, building reformed institutions that aspired to maintain professional ethics even under pressure, that valued documentation and accountability, and that recognized medicine's obligation to transcend political circumstances in service of universal healing mission. The shock of discovering that enemies could be more ethical than one's own regime became ultimately the foundation for transformation, personal, professional, and institutional, that shaped post-war German medicine and contributed to broader democratic reconstruction of German society.